Good afternoon. All right, we'll just be very brief, but of course good news today that we only had one case in hotel quarantine. So once again we're on track with that zero community transmission. So thank you everyone for doing the right thing. And we've also seen an increase again in tests, so 9,734 tests over the last 24 hours, which of course is great news. We've got 63 active cases in our hospital at the moment, so that number's sort of coming down steadily as well. So just in relation to National Cabinet, I'll be quite brief. First of all, I just want to thank the Prime Minister for having Professor Murphy there today, as well as the Chief Health Officer. We were given a very comprehensive briefing on the vaccine rollout. Good news to hear those extra doses of Pfizer having been secured. I think that's wonderful news. And of course, we accept the health advice about the continued rollout of AstraZeneca. We have to put our faith in the medical experts. We've been relying on them all through this pandemic, and that's exactly what we will continue to do. So if anyone has any concerns, they should talk to their local GP. But of course, the continuation of the rollout of the vaccine program will continue in Australia. And like the Prime Minister said, it's absolutely critical that we get that vulnerable population vaccinated. In terms of our 1A, we've had the first doses already administered to our frontline health workers and those in hotel quarantine, which is fantastic, and that will continue to be rolled out. So it's business as usual in Queensland. I also want to thank the Commonwealth in particular for agreeing to the transparency of data. I think this is going to absolutely help us as we move forward, especially in relation to Queensland providing every day the vaccines that we do and the federal government providing the same data that they are doing. I think that's what we want to see. We want to see some transparency in the data because it's absolutely critical that Australians get to know exactly what's happening in their particular state or territory. And finally, can I just say, in relation to the Women's Summit, I think that's fantastic that National Cabinet has endorsed my proposal. This is going to be a game changer for women's issues in Australia. And I'm very pleased that National Cabinet has supported this, and of course we'll be addressing our women's economic inequality at the National Cabinet meeting in July, and I welcome the outcome of that. And I just want to thank the groundswell of support too for women, not just in Queensland but across Australia, because now is the time, and I look forward to working with everyone to bring about some real and lasting change. I'll hand over to Dr Young and then to the Health Minister, and we're happy to take a few quick questions. Thanks.
Thank you, Premier. So excellent news overnight, no community-acquired cases in Queensland, and we've had increased testing. So thank you to every single person who's come forward and got tested. And then fantastic news, an extra 20 million doses of Pfizer vaccine. That is just perfect. So we have two very good vaccines, but because of that increased risk of a very rare event occurring with AstraZeneca for younger people, it would be great to have this extra Pfizer vaccine. It is important that older people who are not at that increased risk of having those adverse events from the AstraZeneca vaccine continue to come forward and get vaccinated. We don't know when we might have an outbreak of COVID-19. We need to be prepared. So people must come forward and get vaccinated. The risk for anyone of getting one of those rare complications from the AstraZeneca vaccine is very low. The risk for older people is extremely low. So that's why it's so important that if you're over age 50 that you continue to come forward and get the AstraZeneca vaccine when it is your turn to do so. Of course, we're starting with much older people at the moment. They're most at risk, and we'll gradually be vaccinating younger people as we go forward. So we've now vaccinated all of the 1A category, which is healthcare workers looking after COVID cases, workers in the quarantine hotels, and workers at the border. That's critical, and we'll continue to do that because, of course, there's turnover of staff. That's very important, and now we're rolling out the vaccine for the most vulnerable, and so it's important that they continue to be vaccinated. But we now, as a nation, have many more options in terms of the vaccines that are available. Thank you.
So we thank Queenslanders for continuing to comply with the current restrictions, continue to wear masks. We're hearing all across the state very high level of compliance, which is fantastic. Reminding people to keep checking in when they're going to venues. Of course, that's social hygiene and social distancing, and staying home when you're unwell and getting tested if you have any symptoms, no matter how mild. I also welcome the announcement of more Pfizer coming. What this means is we can roll out AstraZeneca and Pfizer to the relevant groups based on the most recent health advice, and we'll continue to do that. We're moved into our 1B category, which is our health workers and other frontline workers, such as our paramedics, police, correctional services, and other emergency services. So we'll continue to do that. We'll work with the Commonwealth over the next few days and weeks about recalibrating how we allocate out the 2 vaccines over the various groups. But it is important for Queensland, for Australia, to be able to open back up, to get our economy fully operational. We need Australians to come out and get vaccinated. And the advice that we have received overnight gives us the confidence to go forward and follow that advice and know that the vaccine is going to be here. And we welcome the further commitment of additional deliveries coming of Pfizer over the next weeks and months, and also that larger one at the end of this year. Thanks.
Happy to take a few quick questions.
Sorry, are you worried about the rollout now that we've got these extra doses of Pfizer? Sounds like it's not going to be for much later in the year. Are you worried about how that will affect the ongoing rollout?
No, I'm not, because the federal government's going to be giving us the updated list of the supply chain, which is fantastic news. And I think we saw today that the federal government was very happy to see those extra doses of Pfizer coming in. But at the moment, it's critical for the most vulnerable members in our community and that 1A and 1B group to get vaccinated.
Will it delay the rollout timetable though, and if so, by how much?
Look, I don't have those answers. My information is that it won't really impact on the rollout, but the Department of Health will now work with Commonwealth Health to address any issues, but it's business as usual.
And how are we going to get the Pfizer vaccine out to those remote and regional communities?
Yep. My understanding now is that some of the storage requirements have changed. Is the most recent advice, so there may not be those issues we had in the first instance.
And just the proximity of PNG to the Torres Strait.
Yes.
And the Torres Strait may get the AstraZeneca given the high-risk population. Does that benefit outweigh the risk?
Well, the continuation of the rollout of the vaccine program in the Torres Strait is absolutely critical. So that has been happening because of the high rates in Papua New Guinea. You would have seen that there has been some resources going into PNG, which is fantastic. And the Commonwealth and State are working really closely together to address these issues. So we'll absolutely be monitoring the rollout up there, but the rollout will continue in those Torres Strait Islands.
How many days supply do we have for both vaccines?
Sorry?
How many days worth of supply?
We can get we'll get that information for you. But it's actually going to be quite transparent now, so we'll have that information coming to us on a much more regular basis, which is great news. That's exactly what we've been asking for.
New South Wales has suspended AstraZeneca for the moment. Why aren't we following suit?
My understanding was that was just until after the National Cabinet meeting, but happy to follow that up. Okay?
Will the Chief Health Officer just give us a bit of an explanation about how Pfizer
Yes, sure, and then we'll finish up. I've got an Olympics task force meeting.
We're going to be getting more doses earlier, so it's not just the extra 20 million doses towards the end of the year. Some of those other doses are actually going to arrive a bit earlier. So we'll be able to roll out more Pfizer early, which will suit our process of 1B, then going to 2A and 2B, which is when we'll start vaccinating younger people. So it will all work going forward. Oh, I see. Sorry. Yes, no, that's all changed so that they've done a lot of studies over the last few months looking at the stability of the vaccine, and you can actually store it for 2 weeks in a normal freezer rather than a minus 70-degree freezer, and then you can store it at 5 days at a normal temperature fridge.
And we do see GPs administering Pfizer instead of it just being a...
That's all being worked through at the moment, so we're doing that with the Commonwealth to work out the best way of rolling out these 2 good vaccines, AstraZeneca and the Pfizer.
And Dr. Young, are you happy to continue rolling out AstraZeneca in the Torres Strait?
Oh, yes, of course I am. But we're also working now, because of these changed storage requirements, so we'll be putting a Pfizer hub in every single hospital and health service. So originally we were only going to put them in the larger ones, but now we'll be rolling out across the whole state. So there will be Pfizer vaccine available across the whole state.
And what's your health advice for young people who might have been looking in to have an AstraZeneca vaccine next week? Should they hold off and wait for Pfizer?
They should work out themselves what they think their risks are, and if they'd like some advice, speak to their GP about it. So there's no prohibition here on younger people getting the AstraZeneca vaccine because the risk is still extraordinarily rare.
We've got reports of a lady receiving 1 of each vaccine instead of having 2 of 1 vaccine. Does it worry you that she was able to slip through the cracks and for this to even happen?
It did happen, and I'm sure that the place where it happened will look at how that occurred, but she's fine today, which is very good news.
Okay, thank you.